For over 20 years, Unica has been among the leading fertility clinics in Europe. Our top professionals, state-of-art equipment, as well as a personalized case-by-case approach are the key components that make Unica special. The thousands of healthy babies born through the assistance of IVF at Unica and their happy families are a testament of our efforts and success.
In Unica, the approach is personalized medicine. The patient is the center, and that's one of the things that attracted us to Unica. First time we've been to Unica, we were impressed by the facility, but mostly by the practice, the clinical practice, the high standards that are here. Infertility is a very challenging situation, sometimes devastating. For some couples, the only hope to fulfill their dream of having a child will be using an egg donor.
At Unica, we use the three fundamental treatment options or directions that everyone familiar with the reproductive medicine field knows. The first, the most simple, you can say most natural, is the artificial insemination. The sperm cell of the gentleman is actually inserted via a catheter in the uterine cavity of the woman. The advantage, it's simple, it's natural, it's fairly cheap. Usually this is the approach that the couple that doesn't have any serious problem likes to try at first, sort of to get in touch with the clinic, with the procedures and with the whole approach. The second option is the more technically advanced IVF, in vitro fertilization, where following a stimulation of the ovaries, the eggs are harvested in the patient and eventually mixed with the sperm cells from the gentleman in a special media and in a petri dish placed in the incubator overnight, where the sperm cells are supposed to penetrate the eggs. Of course, we have very little or no control over which sperm cell is going to penetrate which egg and whether the embryos actually are going to be there the next day. The most advanced technique and the one with the best results currently is the so-called ICSI, intracytoplasmic sperm injection, which gives us the highest level of control over the procedure, and only the ripe eggs, the high-quality eggs, are actually taken for fertilization, where a selected sperm cell is injected directly into the cytoplasm of the egg, which brings the highest fertilization rates possible, 80 to 100% fertilization rates. Of course, the treatment is always individually tailored to the diagnostic results and the wishes and needs of the couple. So it's actually set individually, and of course the methods can be combined if necessary. In patients who have poor quality oocytes, low ovarian reserve, or no eggs at all, we can offer here at Unica another treatment option, which is the egg donation. It's allowed by law in the Czech Republic to actually use eggs from a donor who is stimulated, a young woman, healthy, who has been tested and has a perfect bill of health. And these eggs are then fertilized with the sperm cells of the partner of the patient. And following a 5-day cultivation, the embryo is transferred into the uterus of the patient and she carries the baby to term. We have arguably one of the largest databases of donors in Europe, or at least in the Czech Republic definitely, which keeps it an online process. And since the eggs are biologically young, mostly women between 20 and 25 years of age, then the success rates are very high using this treatment option. Over 75% of women get pregnant during the first treatment cycle.
My role as coordinator is to provide patients with motivation, support, guidance and compassion throughout the whole treatment process, respecting the sensitivity and emotionality of the whole treatment. It is really important to create an environment of trust and safety for the patients. Then we also have to help them with organization of all details, including their arrival. We have to be at their disposal all the time and being ready to answer any of their questions. It is a great pleasure for our team to be part of fulfilling our patients' greatest wish.
I think when it became clear to us that we were not able to get treatment in our own country for our second child, we quickly looked towards other countries to see where we would be able to get egg donation treatment. And I luckily already had a good network of other women in similar situations who were going through the same problem and couldn't get egg donation treatment at home. And every time someone would go to a clinic abroad, I would take note of their experience and also their results and see if this could be a potential clinic for us as well. I have a Spanish girlfriend who has a sister who works at a Spanish fertility treatment clinic. But Spain is very expensive and we just didn't feel like the results that they have were justified compared to the price. We also considered Greece, which would have been easy as well because a lot of Danish clinics cooperate with them. But I think at the end of the day, when you get a good connection with the clinic, you just have to follow your intuition and go with that. So we decided to go with Única.
Our experiences here has been very positive and the doctors are doing a very great job here.
Yeah, they also helped us to have a little healthy baby girl, so we're of course very pleased with the results that we've gotten from the clinic. But I also think that just the feeling you get when you enter the clinic is that they really care about their patients and they really care about giving their patients that little miracle that every one of us hope for. I think definitely we would recommend Única to other couples, and we have in fact recommended them to several, and I know that they've also been very lucky to get healthy boy and girls from coming here as well, so we would definitely recommend it.